I'm Dr. Amiya Prasad. I'm a cosmetic, oculofacial, plastic, and reconstructive surgeon boarded by the American Board of Cosmetic Surgery and Facial Cosmetic Surgery, as well as the American Society of Ophthalmic Plastic Reconstructive Surgery and Oculofacial Plastic Surgery. That is a mouthful, but I wanted to make sure that you have that information. Today we're answering questions from realself.com, and just as background, I have been in practice for the past 15 years with offices off Park Avenue in New York City and in Garden City, Long Island. And today's question is, when is a facelift the best choice? This is an excellent question, as in the current world that we live in, the term facelift has been used and abused in so many different ways. When it comes to the improvement of appearance, the term non-surgical facelift, liquid facelift, mechanical facelift, these are all terms that are thrown around in our field, and it makes people very confused as to what is the definition of a facelift. For most cosmetic surgeons, a facelift means lifting the sagging tissue, including the cheek, as well as the skin at the jawline and the upper part of the neck, to literally bring that up. Facial aging is actually a combination of volume loss, which means loss of bone, muscle, fat, and soft tissue. In addition, the skin and the supporting structure under the skin descends. In my practice, we actually use two terms. We use facelift and neck lift, and very often what we are doing is we're trying to address the sagging skin in the lower part of the neck, and that we use the term neck lift for. And when in our practice, if someone, let's say, is somewhere in their 50s and 60s and they have a lot of loose skin, the procedure will be face and neck lift. Let's define for a moment what is not included in a facelift. Eyelid surgery is not part of a facelift. It can be done at the same time as a facelift. Nor is brow lifting surgery, where a lot of patients come in and say, well, I don't want a whole facelift, and then they start making motions like I'm lifting their forehead, when really that's a separate procedure called a brow lift. In the modern world of aesthetic medicine, a lot of practitioners use the term non-surgical treatments to describe injectables and ways to add volume. And although in that way there is a partial solution, it is very often not the complete solution. And in my practice, where we do everything from the non-surgical treatments to injectables to advanced aesthetic surgery, we have a lot more flexibility because we don't have to do the same thing, or we're not limited. So a lot of my patients who come to me for consultation will have spent years going to a physician who would, quote, save them from having a facelift by having them get lots and lots of injectables. And unfortunately, when the skin is sagging, getting a lot of injectables is not addressing the problem, and very often the patients have spent a lot of money, excess of several thousands of dollars over the course of many years. So, to get back to the core of the question, when is a facelift the best choice? It's really a combination of what your anatomy is, and we've had patients in our practice as young as their late 30s and early 40s who we performed limited facelifts on because they felt their lines in this area called the marionette lines, are also called the mesolabial folds, as well as sagging of the jawline was happening a little bit early relative to other people. The other question to answer is, what actually is important to you in terms of the aesthetics of your face? If you look in the mirror and you do what we call as a mirror lift, where you lift the skin and you find that that looks better, then this might be a good time for you to have a facelift. The facelift is the best choice when it's appropriate for you, and when you have some of those key elements of when it's appropriate, such as sagging of the cheeks, losing the jawline. If you're not there yet, then there are some non-surgical alternatives that you can discuss with your prospective doctor. I hope that long answer was helpful, but this is a question that has a lot of different levels. Thank you.